welcome to everyone who is on this call. And I have to say, particularly the many families that have joined us today. Those of us who are pediatric healthcare professionals, we are just now beginning to understand really the enormity of what, let me put it this way, we have done to our children via our response to the pandemic. I'm so privileged to be part of this discussion to begin to shine a light on the enormity of this issue, and hopefully to brainstorm for solutions. It's one thing to recognize a problem and to talk about it and to write reports. It's another thing entirely to take action. And our goal by bringing this project together to start a conversation around this is to generate some action items. I ran across a great quote the other day that said something to the effect of, health is more than the absence of COVID. Health is more than the absence of COVID. And clearly, via the various restrictions we have put in place and the level of anxiety that we have created in our society around COVID, our children are being harmed with respect to their mental health. There are good studies around the world now looking at this. In some, the rates of depression, anxiety, and eating disorder have at least doubled. And as we all know, in Canada, prior to the pandemic, our healthcare system was already strained with respect to having adequate resources to deal not just with mental health issues, but with so many things. And with a doubling of youth mental health issues, the challenge will be, how are we going to begin to address this problem? What strategies can we take collectively as we pull forward together to recognize that we have to take this seriously? There is, I would just say, before we get into, the meat of this discussion with our talented panelists, one thing I would hope we can do, despite the polarization out there, despite the politicization of so many of these issues, I hope that we can begin to come together in a manner that is collegial and always rooted in facts and science, as best as we can understand them at the moment, and recognizing that science, by its very nature, changes opinions based on the facts on the ground as we move forward. You take, for example, the issue around vaccines and the much discussed leaky vaccine, this idea that if you're vaccinated, you can still become infected, and therefore, according to one current of thought out there, the vaccines are not effective. That is simply not true. Absolutely, the vaccines are not preventing people from becoming infected, but the vaccines are doing a stellar job of preventing vulnerable people, primarily the older adults, from getting seriously sick, ending up in hospital, in the ICU, or dying. So the vaccines have been a smashing success story. It is true that people are becoming infected. It is also true that throughout this pandemic, our children have not been at high risk from infection with COVID. The risk from infection with COVID in kids in general has not risen to the level or much beyond the level of a typical flu and RSV season. RSV is a virus that causes bronchiolitis. And those are the facts as best as we can understand them today. And that hasn't changed with the arrival of this more infectious variant. The Omicron variant is infecting many more people, including many more kids. And therefore, because of the increased volume, we are seeing some more children in hospital. But we are seeing larger numbers in my institution of children admitted with typical RSV bronchiolitis, which is a typical viral infection that impacts kids. And those of us who have worked in pediatrics for a long time, we recognize that most viral illnesses in kids require nothing more really than supportive care, some comfort measures, Tylenol or Advil for comfort, and what I call tincture of time, the passage of 7 or 10 days and they get better. But let me assure you, these issues that have cropped up with anxiety and depression, eating disorders, and so on, those things can't be fixed with 7 to 10 days of antibiotics. Those will require a long time to unpack and to remediate. I liken it sometimes when I talk about this in public to a freight train. A fully loaded freight train takes quite a long time to get moving. At first, you can't even tell that it's starting to move. But let me tell you, once it's moving at full speed, and particularly when it's on a decline, it can be very difficult to stop. It can be done, but it takes a while. It takes substantial effort. And we are on that decline now. And it's time for us to take this seriously and to begin to address it.